A cure. It's the holy grail for cancer researchers. James Allison's work, focusing on the body's own immune system, called immunotherapy, has already led to a drug that gives hope to people with advanced melanoma, the most deadly kind of skin cancer. Some experts say this could one day lead to a cure.
Immunotherapy's really changed the face of cancer therapy, and I would predict that it's going to become one of the major and dominant therapeutic approaches.
Traditional cancer treatments, such as chemotherapy, work by targeting and stopping the growth of cancer cells. Unfortunately, healthy cells are often damaged as a result of this process. Immunotherapy doesn't target the cells themselves. It works by activating the immune system to do the dirty work.
Cancer immunotherapy is manipulating your immune system to have it attack cancer. The basic idea is that it works by getting the body's own natural immune system to attack cancer cells, much in the same way that it can attack virus-infected cells.
Doctors are using immunotherapy to treat metastatic melanoma and also some blood cancers. Will it be as effective with other forms of cancer?
There's no reason really why all cancer types should not be susceptible, because again, these drugs do not target the cancer cell. They target the immune system and unleash it. So you don't have to think of it as a melanoma drug or a lung cancer drug or anything like that. They treat the immune system. And so it's a totally new paradigm for cancer therapy. I think right now virtually anybody is a good candidate for immunotherapy. There are a fraction of patients, generally 1 in 4 to 1 in 5 patients respond. We don't know yet how to predict which those patients are.
So this works for about 1 in 4 or 5 people. Is there a way to make it work for more?
Combination of drugs have always been found to be more powerful than any single drug. And the same is true of immunotherapy. If you put them together, the response rate goes from 25% roughly for each one to over 50%. And so the combination is definitely more effective. And there is some very encouraging work of that type that's coming out in studies in human cancer as well, combining the new genomically targeted drugs with immunotherapies, where you view the drug not as a curative agent itself, but as a vaccine to initiate an immune response.
What are the benefits with this type of treatment, especially for people with advanced cancer?
Well, the pros of manipulating the immune system to attack cancer is we know that it yields durable responses, lasting for years to decades now. There's actually one patient in the very first trial that's 14 years out now. That doesn't happen with chemotherapy or other treatments.
Are there any side effects?
They're readily manageable, and they're a lot less severe than the toxicities we usually think about associated with chemotherapy.
Some people are living a lot longer thanks to being treated with immunotherapy.
Pretty clearly, a study of 5,000 patients in melanoma, 10-year survival and 22%. So the goal now, and we know it's doable, is to move that survival tail from 20% to 50% to 70% to 80%. To 100% if we can, and just going for what I think eventually you can call it a cure, 10 years, 15 years, 20 years, whatever, in many more kinds of cancer. And that's the challenge now. It's not to do that because it's done. In one kind of cancer, we know it's doable. The question is just to be able to do it in more kinds of cancer. And it's going to require a whole change in thinking about how to approve cancer drugs, about how to test cancer drugs. Because again, these aren't really cancer drugs, they're drugs that treat the immune system. And so it's an exciting time.